Are you suffering from hair loss and you've been reading online or you've heard from your friends about different treatments, but you're not sure what would work for you? I'm Dr. Anika Goyal, Chief Consultant Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi. Today, I'm going to be telling you the difference between PRP versus hair transplant. PRP, also known as platelet-rich plasma therapy, this is a therapy in which there are multiple sessions. Your blood sample is taken, the platelet concentrate is extracted using a centrifuge, and then it's injected into your scalp. It boosts up the hair growth. Whereas hair transplant, this is a single session procedure in which grafts are taken from your donor area and transplanted to the bald area or the recipient area. How does hair transplant work? Hair transplant is the process in which we are taking out your grafts from your scalp or the donor area where the healthy hair is. It may even be the beard if the scalp is not sufficient, or even the chest. And this is then transplanted to various areas like the frontal hairline, maybe the crown, the mid-scalp. It could even be an old scar somewhere in the eyebrow, which you want to cover up as well. We also do beard transplants, so we may be reconstructing the beard using a transplant. PRP, however, is a different process. This is where we're taking out the blood from your body. We use this centrifuge machine to spin the blood, separate out the cells, and then we take the platelet concentrate and inject it into the scalp. This helps by boosting up the hair growth. It'll increase the hair growth cycle, but keep in mind, this is a slightly longer process. It takes anywhere from 3 to 6 months to start seeing the results, as it does need some sessions as well, and it does require some maintenance. In which procedure is the recovery quicker? This is a common question I get. See, PRP only takes about 30 to 45 minutes, maximum 1 hour. Hair transplant takes anywhere from 3 to 6 hours. So hair transplant is a surgical procedure, whereas PRP is an OPD procedure. So what this means is PRP, you come in, you do your session, you can go back to work right afterwards as well. However, in a hair transplant, you are getting a minor surgical procedure, which means that at least for a day or two, you do have to give your body a break and some rest. Within a day, you can be back to daily activities, but you would have to wait at least 3 weeks before starting any heavy exercises. Now, who is an ideal candidate for PRP? PRP is suitable for anyone who feels the hair is looking thinner, the scalp is starting to become visible, density has reduced, maybe hair fall is also there. So that is an ideal candidate. Whereas someone that is an ideal candidate for a hair transplant is if you have a proper bald area, which means you feel that the hairline is receded, the scalp is now properly visible, the hair follicles are no longer there, maybe the crown is also completely bald. So your androgenetic alopecia or even female pattern hair loss should be more stable as well. So if you are getting a transplant but you are continually losing hair, the hair is still thinning, you may end up needing more sessions after this as well, because the pre-existing hair will start to go. Costing of a hair transplant versus PRP. PRP ranges anywhere from $5,000 to $30,000 depending on the sessions. Hair transplant ranges anywhere from $50,000 up to $2 lakhs, again depending on the number of grafts and the area that we're trying to cover. What you can expect in terms of the results. PRP is taking your natural hair and just boosting up that growth. So this would require maintenance, because this process of male pattern baldness or female pattern baldness doesn't really stop. So you would do medicines along with PRP sessions. Initially, you should do 3 to 6 sessions regularly, and then you can make them a little more infrequent. So maybe after 3 months, 4 months, just to maintain that growth. Hair transplant is a little different. In this case, if you're bald in an area and you're transplanting to this area, you should not need any kind of future sessions in the area. The hair transplant result, at 3 months, you start seeing some growth. 6 months, you can expect around 40% of the growth, and 1 to 1.5 years for a complete result. Ultimately, this is a personal choice. At times, you may even require transplant. So we do have to look at it objectively and scientifically as well, but you may be skeptical or maybe scared of the surgical treatment. So in that case, you can definitely start with PRP and maybe consider a transplant in the future. If you found this video helpful, you can like the video, share it with your friends, and subscribe to my channel.